Hello there. Yes, it's nice to meet you. Welcome to the Smile Zone Dental Clinic. My name is Dr. O, and I'll be your dentist / orthodontist for today. I see you've already seen our receptionist. Thanks for seeing her. I hope you weren't out there twiddling your thumbs for too long. No, perfect. Okay, let me just check your record. I see you've been in before. Yeah, you saw Dr. Blake, is that right? Yeah, okay. Yeah. I'll just have a read. So I see we've had a root canal in 2018. Yeah, just let me know if there's anything wrong. Okay, orthodontic braces or cases in 2019. Yep, and history of periodontitis or some gum infection when you were a kid or younger. Yeah, it looks like Dr. Blake took care of that one. Have you had any issues since? No, okay, that's perfect. You seem a little bit nervous. Is everything okay? Yeah, okay, I understand. So feeling a little bit anxious. Yep, it's quite a common feeling in the dentist office. So I want you to know that I'm quite qualified. I've been doing this job for over 15 years. A lot of experience under my belt. Also, is it mainly the tools that you're scared of? Or yeah, so we will be using a few sharp tools. However, we'll keep the usage to a minimum, and you can always raise your hand immediately if you experience any pain or discomfort, and that'll let me know to stop what I'm doing and we can have a different course of action. Yeah, does that make a bit more sense? Good, I'm glad you're feeling a bit better. Yeah, don't worry, it's a common thing. Yeah. Okay, well, let's move on. I'll just grab a few details to update the chart. It's been a few years since you've been in. So let's have a look. Your full name, please. Yep. Perfect. And date of birth for me now. And just a few questions to round out the chart. Do you brush your teeth regularly? And if so, how often? Okay, so the morning and nightly routine, twice per day. Yep, good. And then how many meals per day? Having about 3, yeah, roughly. Good. Excellent. And last one, have you been performing a routine flossing or mouthwash in conjunction with brushing your teeth? Yeah, so have you been flossing and using mouthwash essentially? You have. Perfect. Okay, that's a big tick. We don't normally get a yes for that, so good on you. Anyway, that'll do it for the updating of the chart. Let's begin. Now, I know we are feeling a little bit nervous. I'll just take the time to explain a little bit of the process today. Is that okay? So as you know, as you're booked in for a general dental checkup, we'll just be using some tools such as my little mirror here, among other things, just to perform some series of non-invasive checks in your oral cavity. We're mainly looking for signs of gum disease or tooth decay, as well as checking the alignment of your wisdom teeth, making sure that they are not going to be problematic in the future. Yeah. As part of today, we'll also be performing a complimentary checkup for your teeth, just getting rid of any excess plaque buildup that there may be around the teeth. Yeah. So, as your overall health is quite a big thing for us here at the Smile Zone Dental Clinic, I will also be providing some recommendations for future long-term, short-term things to improve your oral health. Yeah, does that sound okay? Perfect. And I guess one last thing to take note is there is quite an established relationship between our oral health and our general health. So perhaps we can think not of today as a scary dental checkup, but instead as like a doctor's clinic, a regular physical exam that you might have annually to make sure everything's fine. You can think of today as that maybe. Yeah, I'm glad you feel a little bit more at ease. Perfect. Well, I'll just sanitize my hands and don on some gloves, and we can get started with our assessment immediately. If you don't mind, just giving them a quick wash. And I know you said in your check up with the admin staff at the front that you're allergic to latex gloves, so I do have rubber gloves instead. Yeah, so thanks for telling us. You don't have to worry about that. Okay, we'll just get this one on. Okay, so excellent. Alright, very nice. Now, as we'll be lying down staring at the overhead light, I'll just give you these sunnies or sunglasses. If you could just have them on so you don't get blinded. Yeah, okay, there we go. That's good. I'll give you those ones. There should be a one size fits all, so yeah, that's good. I'll just prepare my little tools here. We've got our mirror and of course our scaler. Our bread and butter, our mirror and our scaler. There we go. Okay, so like I said, please let me know if you experience any discomfort and raise your hand. We can stop immediately or change. So we'll just go in there with our mirror first. Do you mind saying opening up nice and wide for me? Yep. Okay, so just getting in there, having a look. Bit of a check there. Okay. So we weren't lying about flossing our teeth, that's for sure. Good on you, keep that up. Right, let's just have a look with the scaler. Old trusty. Okay. Okay, so we've got a bit of stubborn plaque build up in our third quadrant there. We'll just work on that one. That's feeling okay? Sorry, but I'll let you talk without my hands in your mouth. Can you... Yeah, that's okay. Yep. Alright. Just say R again for me. Yep. Thank you. Good on you. Sorry, I always make that mistake. Yeah. Okay, good. Yeah, so we have 4 quadrants in our mouth that we use to identify where any dramas may be or issues are. So starting with our first quadrant in the top right of our mouth, and then the second quadrant in our top left. Then the bottom left is our third quadrant, and the bottom right is our fourth quadrant. It's pretty much clockwise from the dentist's point of view, just to make our job easier and let us pinpoint things a bit clearer. Yeah, so right, that plaque's finally coming loose. Excellent. A little bit more of that. Okay, yeah, that is good there. A little bit cleaner on that side. Sorry, I get a bit carried away. Got to get everything out, you know. Squeaky clean. Anyway, we'll just give yourself a bit of a rest, give your jaw a rest. We're going to have a quick check for our gum gap or gum lining. Just checking the distance rather, between our gum and our tooth. Yeah, so a gum gap anywhere between 1 and 3 milliliters is ideal. That indicates that we're flossing, brushing our teeth, using mouthwash, all the right things which we are doing already in your case, for a healthy oral cavity. So I'm just going to give a quick measurement there in each of our quadrants. So 1's clear, 2 is okay, yep, 3. Yeah, so anything more than about 5 milliliters we start to worry. It can be indicative of some infection or some issues there, but luckily, my friend, we are in the clear. So that's all arrives at about 2 milliliters on average for all of those. Some of them are 1, some of them are 3 mils, but overall that is quite fine there. So again, you definitely weren't lying about flossing and brushing and etc. So whatever you're doing, keep it up, essentially, is what I'm trying to say. Good. Good indeed. Okay, let's give your mouth another rest there. How are we going? All okay still? Thumbs up? Good. Excellent. Okay, let's just have another look-see What are we working on next? Just check my tools. So, right, now I remember you had braces in 2019, is that right? Yeah, you're in the notes there, your orthodontic cases. Yeah, so we would have gotten some retainers after that as well. Do you remember if you got a wire or a permanent one or a removable one? Removable one? Okay. Did you bring them with you by any chance? Perfect, yeah, okay. Oh, that's them there? Yep. These ones? Perfect. Okay, that's good. We'll just have a quick check of those. Yeah, just give your mouth a rest there, have a chill. Okay, and do these still fit okay? Yeah. Okay, I'll just give these ones a bit of a clean for you, and then we'll pop them in. Just to check the sizing, make sure the fit's still okay. Okay, it's good, bit of a brush there. Alright, now, why don't we pop these bad boys in for you. There we go. Okay, and just give me a nice smile there for me, one of these ones. Yep. Okay, that's good. Okay, so that's looking good. We'll snap those ones out. Yep. Okay, well, I know you've just got your mouth all over them, but they should still be clean. I'll put them in your case for you. Excellent. Okay, well, we're nearing the end there. Just have one more check of your mouth. If you could open up once more for me. Perfect. Okay. Just another quick scalpel check. Excellent. And I must say we're doing well. For someone that was a bit nervous no less than 10 minutes ago, we are doing really well. There's a lot to be confident and smile about, no pun intended. So that's good. Okay, so go ahead and rest your mouth for the final time. Just get this one off. Good. How does that feel? Yeah, you probably feel in between your teeth with your tongue now. We got rid of a lot of that excess plaque, so that's good. That's looking really good. And go ahead. I'll just pour a little bit of mouthwash and water for you out. We can wash our mouth with that one. There we go. Yeah, if you'd just like to wash your mouth with that one. Excellent. Yeah, wash that down. It's a terrible aftertaste if you leave here without washing your mouth. But overall, I think we're doing pretty well. Our oral cavity is in good check. Our gum gap, indicating any gum disease, is all in check. Our wisdom teeth are all fine. They're where they should be. Maybe just get them checked in another couple of years. Keep an eye on them as well. If you notice any toothaches, yeah, come back in immediately. But otherwise, keep doing what you're doing, essentially. Just maintaining your current routine. So I'd recommend a checkup in a couple, maybe about a year. Yeah, an annual checkup's generally quite standard. And hopefully we're feeling a bit more confident and reassured for next time that it's going to be okay. Yeah. So I'll leave you to it there for now. If you liked this video, please, I'd appreciate it if you left a like. And if you really liked it, clicking that subscribe button for more role plays and ASMR content like this. Thank you very much,